Welcome to the Bearded PT. I am the Bearded PT. Have you ever been driving down a highway on a winter's day and you hit a bank of fog? Yeah, you suddenly get a little bit worried, anxious. You grip that steering wheel a little tighter. You slow down so you can stay in your lines. It's safer to do it that way. You have to slow down in order to be safe. Now, your brain kind of goes through the same sort of thing. If you've been dealing with chronic pain, especially with a certain area of your body, your brain, the area of your brain that controls that part of your body, monitoring that area, can also become foggy, smudged. The lines get blurred. So you may recall, we kind of talked about this a little bit ago, that within our brain, you have a virtual map of your body within certain parts of your brain. And there's certain real estate of your brain that is responsible for monitoring each body part of your body. Your foot, your knee, your back, your neck, your ear, your whatever have you. Now, certain parts of your body, those more important parts, those parts that we use a lot, like your hands, our face, have a larger area, more real estate in your brain that's devoted to monitoring. Now, what we have found is that in the research, that when folks are dealing with persistent pain, things like neuropathy, chronic regional pain syndrome, or complex regional pain syndrome, or CRPS, other neuropathic pains, and also just chronic pain, so those areas of your brain that monitor those body parts do get smudged, and that's the term they use, neural smudging. And when this happens, what has happened is that your brain gets rewired, and when this smudging happens, it actually ramps up even more pain. Well, isn't that fun? So, not to worry, there is a strategy, there is a method for helping you rewire those pathways and cleaning up those areas of your brain, and that is through graded motor imagery training. Now, this strategy, this method was developed out of Australia at the Neuroorthopedic Institute, and it comprises of 3 basic training levels, and we can actually stack in a 4th one in there. First, it starts off with establishing what is called laterality, your ability to distinguish what is left or right. What the research found is that folks that have been dealing with, let's say, for example, hand pain, left hand pain, they struggle with identifying even what looks like a left hand, even though it's not potentially their hand. And so by reestablishing those connections that this is a left hand, that's a right hand, this is a left, this is a right, it actually helps to clean up that smudging and it starts to reduce your pain. And once you master that level, you move on to what's called motor imagery training, or imagined movements. Start imagining yourself in seeing yourself doing the things that you want to be able to do that are difficult because of the pain. And so we can actually train your brain into thinking and believing that movement is possible without triggering pain, that pain neural matrix. And by doing that, we are training within your brain to activate your movement patterns without also activating your pain patterns. Now, another level, the 3rd level, is mirror image training. And so that's where we use a mirror to actually give your brain the perception that that body part is moving and it's not eliciting pain. So this is also very effective and has been effective for folks with phantom limb pain, because when you have phantom limb pain, you don't have that body part anymore. But if you stick a mirror in there and you look at the reflection of the intact side, your brain, through your eyes, now sees what looks like a normal body part. And by doing that, it actually seems to ramp pain down. Now, there's a 4th level that we can stick in there that we've learned about. That is sensory discrimination. So that can either be interchanged in the 2nd or 3rd step in there. So first being laterality, 2nd being motor imagery or imagined movements, 3rd being sensory discrimination. You can interchange 2 and 3, and then mirror training. With sensory discrimination, what that is training your nerves and your body to be able to feel the difference between sensations. Is this 1 or is this 2 points? Is this warm or is that cold? Is this sharp or is this dull? Is this soft or hard? So on, so forth. By doing that, you're giving your nerves something to focus on, trying to get them to send correct information and get your brain to interpret it as correct information. So yes, graded motor imagery training is quite literally retraining your neurologic system, your nerves and your brain. We are rewiring your brain, and by doing so, that helps bring pain down, and I've worked with several folks that have had a lot of success with this. Is it easy? No. It does take time, and it has to be through the progression of each step. So if you are dealing with phantom limb pain, chronic back pain, complex regional pain syndrome, CRPS, other neuralgia or nerve pains, neuropathies even, this has been shown to be very effective. So there you have it. Train your brain to clean it up. Thank you for joining me, folks, today. Let's get moving. I am the Bearded PT.